Namaste and a very
Namaste.
good evening to all here. I extend a very warm welcome to Dr. Sunita Tandulwadkar the President of FOGSI, who needs no introduction, and Madam has strictly told me not to waste time in introducing her. But I would say that she is a personality who comes very rarely in this age. Madam, a salute to you. And of course, we have another doyen in the field of medical education and OBGYN practice, Dr. M.G. Hiramat, who is going to be my guest today. And he has been in the field of medical education for the past 25 years. And sir was asking me, are you going to take an examination of me today? I said, no, sir, we're going to learn from you today. And all of you are familiar with Dr. Sunita Tandulwadkar and the extempore activities she has done this year. And the new kid on the block is the Alive, the regenerative medicine program, I think, which all of us should embrace. Thank you, madam, for giving me this opportunity. And indeed, I feel sad that this is going to be the last episode, but it is never the time to say goodbye. We will always be there together. So today, this is the 323rd episode of Gyan Pravah, where the topic is going to be the future of medical education, how we can mold OB-GYN practices, and who else could I choose better than Dr. M.G. Hiramat. So Dr. M.G. Hiramat is the director and the KLE JGMMC KLE Hospital and Medical College in Hubli. He has been the ex-principal of the KLE Kahets JGMM Medical College in Hubli. He is the academic council member of Kahets. He's been the chief patron and the strong foundation behind our very strong Karnataka State OBG Association, and we are all indebted to him for this. And he's been the former director of the Karnataka Institute of Medical Sciences, that is in Hubli, one of the first institutes in Karnataka. And he has been heading the OBG department, and he has led the institute as a director, as a principal, as a medical superintendent, and hence he is well versed in medical education. And of course, sir has many, many accolades to his cap. He's been the ex-chairman of the FOGSI Breast Committee. He's the past vice president of FOGSI, past president of Hubli Dharwad, and of course the Karnataka State Association. He's been the past Senate member of the Karnataka University in Dharwad, past president of Rotary Club of Vidyanagar Hubli, and of course the Secretary General of the Karnataka Medical College Alumni Association. He has received various awards for his extemporary work in the field of medical education and OBGYN practice. And it is indeed a privilege for me to have Dr. M.G. Hiramat over here on this platform of Gyan Pravaha with the greatest star, Dr. Sunita Tandulwadkar ji. I request Dr. Sunita madam to kindly give her opening comments and open the program. Over to you, madam.
Hi, Bharti. Thank you so much. And thank you for having my best friend, Dr. Hiramat. We were vice presidents in 2017 together. He, myself, and Bhaskar Pal, and we had such a great time together. Dr. Hiramat, I'm so thankful to you for coming on a FOGSI platform and being part of this podcast series. Every day, 8 p.m., today 323. It's unimaginable, unbeatable, and it's possible only because of all my fantastic committee chairperson. 30 days, 30 people take it so seriously, and they choose the best of the faculty and their dialogues. If now Bharti herself listen to her February, and now in December she will realize she has evolved in the way she is going to have this podcast. So they have become a leaders of our FOGSI, and I'm glad and I congratulate each and every one of them.
Thank you, madam. Thank you.
Our protocol is I join the viewers link, and you both will enjoy the dialogue. See you on the other side. Thank you.
Thank you, madam. Thank you for the great initiative.
Thank you.
Welcome, sir, Dr. M.G. Hiramat, and indeed an honor and a privilege to have you as my guest today, where we will be deliberating on the scope of medical education and how to improve and upgrade, especially the OBGYN practice. So to start off, I know you have been an educator and in the field of medical education for the past 25 to 30 years, and you have proven your mettle. Yes, you have proven your mettle. You have administered whichever post has been assigned to you with utmost competency, discipline, and diligence. To start off, I would like to ask you, what do you see in the transition over the years from the day, as you said, in 1974, from the day you took your last exam, to what is happening in the medical field, more so in the field pertaining to obstetrics and gynec practice? What are the changes you see which are towards the good, and what are the changes which you say should not be there?
Thank you, Bharti. Respectable President of FOGSI 2025, Dr. Sunita Tandulwadkar, my very close friend, associate, and Dr. Bharti Rajshekar, past President of Kasoga, Perinatal Committee, FOGSI, giving me this opportunity to be on this platform at the fag end of the tenure of the year. I am very happy that you have been selected a topic which is very close to my heart. For the last 45 years, I am involved in the medical education as a teacher. I joined as a teacher in 1982. Since then, I have taken so many ladders, but still I never left teaching. Even today, being a director of a medical college, I still take at least one class per day. So I have seen the medical education from very close angle, right from the beginning of my career. As you know that in 1956, the Medical Council was established in India. And this Medical Council formed the protocol of how to teach the undergraduate students. That went on for a long year. But later on, in the last 10 to 12 years, the MCA was replaced by NMC, National Medical Council. Tremendous changes have been taken in the last few years. What we saw as an undergraduate, when we were undergraduates, there were only gigantic lectures, hours together. And half of the batch used to sleep. Another half used to chit chat. Now the whole thing has changed so much that a student cannot sit and sleep even for a minute also. So tremendous transformation has taken place in the field of the medical education, and especially after coming the NMC. And as you know that the newer gadgets have changed a lot. Earlier, teachers never had a good mic also. And those who were sitting in the back bench, they were never used to listen. Now today, so much of advancement has come, particularly in our medical college. We have introduced a multifaceted the teaching aids, that wherever he turns, he has got a screen. No need to see only the teacher. And wherever the teacher goes on the platform, the cameras move. Such is the transformation we are seeing. Overall, the teaching and learning in medical institution has changed a lot. And that is only to bring up the best good doctors in our country. The NMC has made goals. As per the goals of the NMC, the teaching and learning has changed a lot. Especially, Bharti, what we see in the teaching and learning is the skills. Earlier, skill teaching was not at all there. Now NMC doesn't permit any medical college to admit the students without having a skill lab.
Skill knowledge.
Just now today we received a cadaver skill lab. You touch the body of the cadaver body, if I touch the breast, whole screen is on the breast.
Wow.
So multiple, and it starts teaching the students. I need not speak. Just I keep my button on the body.
Excellent.
If I keep the button on the heart, the mic will start on its own and it tells everything about heart.
It is all simulated teaching.
Transformation has occurred in the medical education.
Yeah, I think that is excellent, and we wish that we could go back to those colleges and
Now
have a relearning. It sounds very interesting because as I know,
even if you are not a student now, just for the sake of heck of it, you go to a medical college. There are very good medical colleges in our country where they have, for example, this technique, what I told is, this has costed us 5 crores rupees. Just one mannequin, 5 crores. Imagine.
So as you said, sir, India leads in the field of medical education. We have the highest number of medical graduates coming out of our country. And as you said, what to do is knowledge. How to do it is skill. That is very, very important. That's what is the focus nowadays. And when to do it is going to be our intelligence. We cannot depend on artificial intelligence for this. So,
Yes.
as you said, the NMC has formed guidelines of competency-based teaching, interactive teaching programs, skill-based teaching programs. So, there's much beyond the textbooks that
Yeah.
is necessary. So, of course, the same thing carries on to the OBGYN, because we are all focusing
Yes.
on the reproductive medicine. So I
Yeah.
would like to know from you that what are the transformations that have occurred in the field of obstetrics and gynecology,
Yeah.
which will definitely help us in empowering the women of our country.
Yeah, Bharti, when we joined post-graduation, there were only two divisions. One was obstetrics to deliver the mother.
Yes,
Other was to do a hysterectomy in a
gynecology.
Otherwise, only two choice was there. Now there are more than 10 different subspecialty in OBGYN.
True.
For example, if you want to become true only obstetrician, you have to be only obstetrician, then only you can give a better service. If you take up gynecology, you have to be only gynecologist to look after the woman. And new things which have come is obstetric medicine. This is a very new division where the pregnant women are more prone to develop lot of the medical disorders.
NCDs,
And
yeah, the
one
NCDs.
who takes up this division, he should be master of all medical disorders. And the urogynecology is another branch, infertility is another branch, assisted reproduction is another branch. Believe me, when I was postgraduate, I had not seen endoscopy because no endoscopy was in my medical college.
Of course.
Believe me that I had not seen an ultrasonography machine because ultrasound machines
It's
were
not
not
there.
available. And today, fetal medicine has such an advancement that one can become a specialist in fetal medicine. And oncology has grown so much, gynec oncology.
Yes.
There are 10 avenues for a postgraduate who comes out that he can do the fellowship, he can do the MCH, and he become the masters.
Yeah, they
So
can be
not
more
like
focused.
30 years back when we completed our post-graduation. Either you start a hospital and deliver the mother, or you do a hysterectomy for each and every one. Now, 10 times think before doing a hysterectomy because so many new gadgets have come.
Yeah. So as you said, sir, we have to integrate medical disorders and NCDs into our OBGYN training today, because
Yes.
gone are the days when we rarely see women who don't have some of any one of these diseases like hypothyroidism, diabetes, obesity, hypertension, autoimmune disorders are being detected more and more in pregnancies. And hence, we not only are OBGYNs, I think we have to know a little of physicians, cardiologists, endocrinologists. We need to know a little.
Radiology,
Yes.
ultrasoundologist you have to be, and you have to be physician, and you have to be everything.
Yes,
surgeon.
not just the uterus and the baby. We need to go beyond that.
Fetal medicine also.
Yeah, so that we say that OBGYN must move from pregnancy only to women-centered lifelong care.
Yes.
Because I think we are the people who they feel very confident, women feel very confident with their OBGYNs when they want good health care.
Yeah.
So
Even
taking
for
this
learning
into
also, Bharti,
perspective, yes, sir.
earlier it was only knowledge based.
Yes.
Now it is just knowledge will not help. You have to be a skilled person.
Yes.
That is the competency based NMC which is recommending.
Yes. So that skill based training, I think, is what is very, very essential, and it is being done. But over here, I would like to reiterate and ask you, sir, that in our days, though we did not have the ultrasound, we did not have the good radiology backup or imaging backup, we didn't have an endoscopy. I'm sure that there was some amount of skill transfer at the bedside. But we had great professors whose hands knew everything.
No, we had excellent teachers.
So could you just tell us a little so that the listeners who are in that field, who are there, can understand how we have transformed?
They were great teachers, I tell you. We have not reached to their level, even to their half. And the present generation, what I am seeing is that it is very, very poor. Qualities of a teachers are not existing in the present new faculties because they are not much dedicated. What we used to see those great teachers, and they used to impart the knowledge in such a way that without the gadgets, they used to impart so good.
Yes.
With the gadgets, we are not able to impart to that extent. That is also a very important thing we should note down. And aptitude of our learning has become very, very less. True. In those days when we were postgraduates, whenever we used to go for any conference, we used to go and sit at 8 o'clock itself to get the front row.
Yes.
Now today postgraduates will come at 11 o'clock after taking tea.
So now also you are only in the front row. You are
Yes.
only in the front row.
Yeah.
In all the conferences.
Learning has become very, very less.
Yeah.
And that is the problem what we are really facing in medical education. And too many admissions, increasing the admissions from 100 to 200, 200 to 250. No, this is not really medical education. According to me, in any medical college, there should not be more than 100 students. And in any teaching, clinical teaching, there should not be more than 10 to 15 students.
Yes, 12. I think a
Today I
dozen
got
is
40 students in the small chamber. Other day, my chamber was so small, 3 girls fainted because there was no proper air.
suffocation, because of suffocation.
So
So I
that
think these
has
are
to
the
be
handicaps
bedside.
we are having.
Yeah, bedside teaching should come back.
Yeah.
And proper clinical examination should be there. Now the trend has become so much so that as soon as the patient comes, they refer for ultrasonography, they send for MRI, they send for CT without doing a clinical examination.
Very true.
Again, the clinical examination should be the priority.
So as you said, the
wellness.
number of medical colleges, the number of medical graduates are increasing,
Now
but
72
definitely
medical colleges in Karnataka.
the skill and the aptitude has definitely come down.
Yeah.
So keeping this in mind, we know that we have to do a lot of reforms, as you suggested. Like we
Yeah.
need a curriculum reform, or we need to have different type of teaching programs to inculcate the spirit of healing in these medical graduates, because they need to know that learning medicine is not just for a living. It is
Yeah.
going to ensure the entire health of the community, and we are responsible for that. I think in this aspect, sir, how would you think that we could, along with Kasoga and FOGSI, try to maybe get into the government, get into the medical education department, and try to introduce what reforms and how we can introduce them?
See, Bharti, FOGSI is doing a tremendous great work, I tell you. Though it is not a medical college, though it is not having anything to teach, but the teaching, the number of conferences, number of CMEs, as right now told by Dr. Sunita, every day an episode, and
Yes.
today it is 323 episode. See, this type of learning has brought too much. And now we have to change our pattern of teaching the students. And that pattern should be that students should become teachers, not we. And small group teaching, other deliberation, these are all very important that we can change. And the skill based, in fact, there are very few medical colleges where there are fantastic skill labs. And with skill lab, and you will definitely make the subject very, very easy. Unlike in previous days,
Yes.
where standing
Easy and
on the
interesting.
lecture, on the theater. So it is a lot of changes are going to happen, and they are already happening.
Yeah. So as you said, the simulation-based training is going to be an excellent tool, and it creates a lot of interest in the students. And I think even the knowledge transfer takes place very well.
Yes.
But as you mentioned, there are some high competency areas where we need to focus in OBG practice, because we still have to bring down our maternal morbidity statistics and rates in few of the low middle income and few of the northern states of India. So in that case, what are the most important things you think we should focus on?
See, we have to focus on detecting the high-risk pregnancy in every obstetric unit. On the first visit only, you try to find out whether you are dealing with high risk or low risk. And if you are dealing with high risk, be more vigilant, have more antenatal the visits, because it is not fixed. And then do good surveillance. Fetal surveillance must be done in all these cases. And be very perfect with your medical treatment. Every day new advancements are occurring. There may be many drugs which have come, and you can't use the old drugs what you are using. And detect preterm labor, because one of the leading problem we are facing is preterm labor. And this surveillance will definitely help you to identify preterm labor, and you can prolong the pregnancy, and you can gain the weight of the baby and prevent the baby going into the NICU.
Yes.
So management of preterm labor is very, very important. Cardiac disease detection early, treat them, take the help of the cardiologist. And gone those days when woman had a severe cardiac disease, never think of getting a child, we used to tell. Now today with major so many surgeries occurring in cardiac, and cardiac surgeries have become very, very popular. And they are the perfect also. I think they can have the children. And operative skills are vanishing, Bharti. What I feel very bad is Today, I don't see anybody using the ventures perfectly, the forceps delivery, and there may not be a high forceps, but everybody should be well trained how to apply low forceps.
Yes.
Believe me that in my nursing home, every delivery is almost a outlet
Assisted with the
because I
outlet.
don't have that last patience of 15 minutes waiting for the head to come on its own.
Yes.
By the time you apply, because this is a training and nowhere these trainings are happening, I think we should have a training programs. We should have the operative skills should be developed. In cesarean also, many are not able to do difficult cesareans.
Yeah, they deliver the head or in
What
a
we have got
transverse.
in Kasoga, the workshop for cesarean. In the last few
Yes.
years, we have done so many workshops.
True.
And in every workshop, they can sit and learn. And skills are very, very important. Then we can help a large. And what is our aim is to bring down the maternal mortality. We have brought down to a great extent, but still lot to be done. And near miss also should be identified. That is very important. And
Yes.
WHO recommendations should be followed. The
The
FOGSI
protocols.
recommendations should be followed. And
Protocols should be followed.
yeah, all these, if we know, then we are able to do it. And particularly, I concentrate on PPH, hypertensive disorders of pregnancy again, one of the
Yes.
leading cause of death. And if you properly detect the hypertension, manage, you can carry on the pregnancy to such gestational age where babies can survive. And diabetes has become again a big problem that should be looked into. And sepsis, early sepsis detection and treatment, that is also very helpful. Good fetal surveillance. We have a very good fetal specialist, but good. And emergency operative deliveries. And these are to be done. I think we can bring down the maternal mortality still. But maternal mortality cannot be brought down by only by obstetrician.
Exactly.
People should join, politicians
It's a social
should join,
system. The whole
government
social,
should support.
the
And
social
there should be a
system
good
has to.
understanding between the government and private.
Yes.
Government people blaming the private, and I think that is creating a lot of problem and bringing that you should not do too many cesareans.
Yes.
And every cesarean seeing with a suspicion that whether you have done. See, do cesarean whenever it is definitely indicated.
Necessary.
Overall, the cesarean rate has increased, I do agree, but not to the extent what is now seen, 70%, 80%.
Yeah, it's not
If
that.
somebody is able to do it between 30 to 40% is fine, good enough,
Yes.
that you can have a reduced mortality. So we should look into that. That is very, very important. And another is the postnatal examination, post PPH, the PPH if it is occurs, and lactation also we should concentrate more. Newborn lactation is another very big problem. That also we should not give it only to the pediatrician. It is our responsibility.
The first 1,000 days, I think we should also be involved.
And more important is counsel for family planning.
Yes,
Nobody
contraception.
has got a time to talk to them about family planning. At least during the postnatal period, when the woman is with you for 5 days, you try to counsel. Many of them they agree because they are not knowing that it is so beneficial.
Yes, they don't know.
So these are all high areas where I feel we should intervene. And eclampsia again, it has almost reduced a lot. It is not there. So these are the things which I feel you should concentrate, and the specialists should be involved very well so that we can do a lot.
Yeah, as you said, sir, I think we have to take the medical students or the postgraduates on a case-based learning system.
Yes.
So that and that is, as you said, in the bedside clinics, that is the biggest textbook you can. The best textbook is your patient who is with you. So in that you can tell them, like for example, if she's anemia or she's come for hypertensive disorder, if the whole thing discussion takes place there, they know hands-on what is to be done, and that I think will definitely make a difference in providing healthcare. And I think medical education is not just textbooks. It is not just reading the textbooks and trying to pass an examination. It is more, as you said, practical, and the presence has to be there at that point.
Yes, definitely.
Because nowadays we are seeing that most of it, they're thinking, yes, textbooks we are reading all the textbooks and everything is there. But actually when medical graduates graduate and they go to a rural setup, when they see a patient of eclampsia or they see a patient of diabetes, they are in a state of confusion as to what to do. They really are sometimes confused. I think these things have to be involved in the medical education process itself. So maybe involving them, taking them to though the community programs are there, most often these community programs are not being utilized properly. I would like
implemented also, not properly implemented.
Yes, I think that something has to be done about that, I feel.
And one more, Bharti, I would like to touch upon research. When
Yes,
we were
research.
undergraduates, I had never heard a word called research in medical college. And as a faculty also in a government college, hardly
Yes.
we produced a paper also. Now research, coming back to the KLE,
Uh,
the university, research is the most priority. Salary is paid based on the research. And
the
this time
papers.
our vice chancellor is so keen that
Uh,
every faculty should have two research papers, that to a standard of Scopus publication. So research will make lot of difference.
yes, auditing
For
and
example,
research.
even we
Uh,
have got research for undergraduate students,
okay,
and we
very
have
good.
got exchange program that
So
our
this is in
students
the
will go to
NMC,
the
Dr. Hiremat.
USA.
Is this part of the NMC
Yeah,
curricula?
yeah, our own KLE has got so many the MOUs with so many universities in USA, Australia. Right now, 10 of our undergraduate students of final year are in America.
Oh,
They have
excellent.
got an exchange program.
Hmm.
So such is the change. I think that will make them much exposed. And research grants, university should give research grants to faculty. Our
So
KL
they can
University
mentor
has
the
reserved.
students.
They give to the tune of 5 lakhs to the faculty and 1 lakh to the student for a
So they will
year.
mentor. The
So
student
mentor,
will get
the
incentivized
research is
to
very
get
important.
into research.
And another area what I would like to touch upon in medical education is mentorship.
Mentorship, yes.
Very important. The HOD should mentor the assistant professor, associate professor. Faculty should mentor the postgraduates.
Yes.
Postgraduate should mentor the undergraduate. In the undergraduate, final year student should mentor the second year. The second year student should mentor the first year.
Very
If
nice. Yes,
this
I
chain
think
is built very well, then there is a very good teaching atmosphere in the college.
exactly. The atmosphere will be wonderful.
Yeah, this mentorship should be taken in a priority, and even NMC also stresses on mentorship. That every time NMC says that good mentorship should be done, both longitudinal and horizontal mentorship.
Okay. Yeah, as you said, because we all used to look up to our professors, and today also we remember the words they uttered in the text in
Yeah.
the classroom, and we
Yes.
try to put that into practice. So I
Yes.
think when you mentor somebody, they are going to be your torch bearers for the knowledge you
Yes.
have imparted to them,
Yes.
and they will be a reflection of yourself.
Yeah,
If you mentor them
definitely.
properly, I would like to say.
Definitely.
So it is not that it is hierarchy or it is a supremacy or inferiority. It is just transferring knowledge in the right way so that it is utilized in the proper way.
Another thing I would like to add is SOPs.
Huh.
Today, SOPs are available for every case management.
Yes.
You have a SOP for hypertensive disease, you have a SOP for anemia, you have a SOP for labor in the labor ward, you have
Yes.
got SOP for PPH. SOPs should be strictly followed.
And
Definitely your maternal mortality, morbidity also comes down. It is
yes.
not just maternal mortality, Bharti. Morbidity should be
Yes,
considered.
morbidity, the overall health.
Every one maternal mortality, there are 100 morbidity.
Amel, it is not
Don't
only
concentrate on morbidity.
physical health, it is also
Yes.
the mental health. We have to look
Yeah,
into the
mental
perinatal
health
mental
also
health.
should be considered. Unless you look into that, it is not possible to bring down. And what exactly we want is that every mother should be healthy, both during pregnancy, following delivery, throughout. And we should try to detect the diseases also. See, so many people are dying with cancer cervix. So many people are dying with breast cancer, and both are preventable,
Yes.
unfortunately. And we are not making any attempt. I tell you, many of our gynecologists, they don't examine the breast of a woman at all.
Yes, it's very true, sir. Very true.
At every visit, you make a point that you can detect the breast cancer at the earliest.
Yes.
I was the breast committee chairman.
Yeah.
We conducted 30 workshops. And in every workshop, I used to tell, during every visit, just talk about breast disease. Just tell her that if she is not willing, you ask her to go home, stand in front of a mirror, and palpate the breast in the 4 quadrants. You will know that whether you have a disease or not. And see, prevention of breast cancer is very important.
Yes, sir, because it is very,
Prevention
very
of
common
cancer
nowadays.
cervix is very important.
Yes.
And routine doing ultrasonography for every woman above the 40 years, you can detect the ovarian malignancy.
Ovarian tumors.
Because ovarian malignancy is another leading cause of death in the mother. So these are all simple things which we should implement
Yes.
and make it a protocol.
Yeah, like for example, as you said, sir, in my outpatient consultation, and my staff are also trained.
Yeah.
Height, weight, BMI, breast, CVS, RS per abdomen, PS. This
Yes.
has to be there on my OPD slip. And we have a flyer poster
Yeah.
which we give in the local language. On
Yes.
one side, it is about HPV screening, PAP skip, why it is to be done and how it is to be done. On the other side, it has about self-examination of the breast and
Yes.
when they should come to the doctor. So this is given to every single person who walks into my outpatient. And now my nurses, even before they check the blood pressure and weight, I tell them, put your hands to the patient's breast first.
Yeah.
Before even I go to the patient, the breast will be examined by them once, and then I put my hand to the breast and make it. It's mandatory in my practice.
Mandatory. And another area, what I feel, Bharti, adolescent health is very important.
Yes.
We are neglecting that the group of people.
You have to start early.
School
Yes.
health program, in the school health checkup, identify PCOS, and start giving them proper education. They will have a better reproductive life.
Very true. Very
Otherwise,
true.
once they develop a severe PCOS, they come for infertility.
Yeah.
At that time, so many
And then
changes
diabetes,
happen.
hypertension.
Yes, diabetes, hypertension, obesity.
It's a chain.
Obesity is going to become a big problem in our country.
Yes, sir. It is already is.
Obesity should be identified.
Yeah.
And
so, sir, I would like to say, is there a missing link of faculty development, which I think we are seeing with the mushrooming of the numerous medical colleges, and many of the medical colleges are short of experienced staff, faculty members, and I think there is a missing link in proper medical education.
No, as per the NMC, every medical college should have a faculty development program. And in the faculty development program, basic learning programs they are going to teach. So this is taking place a lot. Earlier it was not there, but in many colleges, there is a separate medical education department.
Okay.
One of the senior professor will be heading that. And group of people who are interested in medical education, they become the faculty. Faculty development is very, very important. Unless
so
you
on this point, on this point, with the new medical colleges coming up, most the NMC regulations or the regulations are that to become a professor, you have to been in the hierarchy of an assistant professor, lecturer, and you should have been in the medical college.
Yes.
But you know that there are numerous practitioners outside the medical colleges, like private obstetricians and gynecologists, who have an acumen for teaching.
Yes.
And there is a shortage of faculty in the medical college. There is an surplus of interested people who are interested in getting to teaching. So I'm not sure of this, but I heard that NMC has
in the last 2 years, NMC has permitted to take the faculty interested for teaching as a guest faculty.
Yes, guest faculty.
As a guest faculty, and there is no mandatory biometrics for them.
Okay.
Because they can't come every day.
Yes, true.
So they have told that there should be an honorary teachers to be reintroduced in the system. Okay. I think that will help a lot, because there are people who are already established practitioner, but they are good in subject very much.
Yes.
So we have taken in our college many of them. Okay. For example, right now I have been appointed as emeritus professor. Even though I'm 70 years old.
Yes, you are emeritus.
I cannot become a teacher.
Yeah.
But they have given the designation of emeritus professor.
Yes, I think.
And we had another very senior, 82 years old radiologist, great teacher. We have taken him as a emeritus professor.
Yeah, I think we will learn a lot from all people like you.
Yes, definitely.
Needed, much needed.
At least if they can't come every day, give them an option of coming once in a week or twice in a week. They're willingly come.
So, is this option available only for private medical colleges or even for the government?
No, even in government also, NMC has permitted.
So, yes, I think because that shortage.
Quite a good number of old students at that college.
Yeah, they want to teach.
Very keen to go back to their college and teach the students.
Yeah, like I am one such person who is very keen to always go and teach.
Yeah.
Because as you said, sir, teaching is one of the noblest professions. One I would say is a teacher, and second is a doctor, and you are both.
And it is a passion, you know.
Yes.
It is a passion.
It's a passion, exactly.
Teacher, then you can't remain without teaching.
Then
you start teaching your nurses in the hospital.
Oh, true, very true. You start teaching somebody. If not the nurses, even the patients, we start teaching. I start teaching to my patients also.
Patient education is a teaching only.
Education, yes.
That you are making your patient to understand the problem. I think definitely you can do a lot. So basically the medical education has got a very good future. Only thing is that the government and NMCs should curtail bringing up too many new medical colleges. And now what is happening is so many medical colleges are given without having any proper facilities.
Very
and
true, sir.
they should be very strict. NMC should not give a medical college to anybody who has asked unless the basic requirements are there.
Are fulfilled, and I think
can be done. And mushrooming of the colleges must be stopped. And the students' intake should be restricted.
Very true. So I wanted to say that they should reduce the intake. And there is a lot of discrepancy between the undergraduate.
Only one medical college in Karnataka, St. John's Medical College. This is a 40 years old. Their intake is only 75.
60 or 75. They don't take
60 or 75. They have not increased. Look at the other colleges. They have increased to 250.
250.
Only one college. They are running 2 colleges of 250.
So 500. And there is a huge discrepancy in the intake in the undergraduate and the postgraduate.
Yes.
So again, those medical graduates are in a confused state, and they undergo a lot of mental stress when they are trying to get into their postgraduation.
And even in postgraduation, 25 PGs are admitted in OBGYN. Their number of deliveries are less than the students.
Exactly.
What they can learn, you tell me. You need to have at least minimum number of clinical material. Based on that, you should give the number.
Yes.
You know that numbers are increased in a different way.
On this aspect, sir, you know that when people enter medical college, be it undergraduate or postgraduate, we see a lot of mental issues in these youngsters nowadays.
Now, we just did a survey last year.
Okay.
We did find out of our 800 students, 15% were mental problem was there. 15%.
So how did you
themselves? Many a time when you interrogate them, we did a one research. When you interrogate, who will agree that I have got mental problem?
Exactly.
With all that, including 15% of our students have got mental problem.
So how do we tackle this problem, sir? How would you help them?
How is that we need to counsel them, and we have told our professor of psychiatry and HOD, we send them in a group of 10. So we are managing. Hardly only two students are severely psychiatric. Otherwise, they have managed, they have overcome the failures. Now they are doing well. And it is mandatory that's why I told you, these all will come only in the mentorship.
Yes, in the mentorship, exactly.
Colleges,
you have somebody is mentoring them.
Only 10 students to mentor.
True.
And they can mentor on mobile also. Okay. They can talk to their students on mobile also. They can conduct any program. I think in mentorship, this is going to help.
I think there's because they have somebody to speak to, and they know that they will
just you ask them, they will come out.
They will come out.
First visit, they may not open up and come, but in the subsequent visit, they will tell you what are the problems. And if they are tackled at early, probably they don't need any medicine at all. Counseling.
Well, sir, before we move on to your experience as a teacher, I would like to put one thing, that what would the advice you would like to give to all our student listeners who have already entered the medical field, how they can become good teachers, how they can become good healers?
Yeah, first thing is, I tell our undergraduate students, to become a doctor, you don't need too much brain.
Yes.
Even an ordinary person also become a doctor. Maybe that to become an engineer and scientist, you need an extraordinary brain. Just what is needed in the medical education is sincerity, regularity. If you are regular in your learning, everybody will pass. And today it is a competitive field. They should know it, because we are in the crossroad. In the society earlier, every doctor was thought that he is God. Now nobody is going to accept you as a God.
Exactly. We don't want to be also.
The day complicates, he will be the first person to throw the stone on your hospital.
Yes.
And break down your glasses. So it is not very safe to become a doctor now. And it needs a lot of mental stress. And a lot of mental stress is there. And definitely it is a passion for every medical student to become a teacher. And when they have got a passion to become teacher, definitely they have to look at the seniors, how they were. And based on that, they should be. Otherwise, just becoming a teacher and not attending the classes, you are not only spoiling yourself, you are spoiling 100 students along with you.
Exactly.
So remember, if you have no passion for teaching, don't come to medical college. Go to the society, start doing a practice. you will be much in a better position. And nowadays, what is happening is too many medical colleges are coming. Learned teachers are not available. They create teachers. Now, these
Okay.
created teachers cannot be teachers, I tell you.
It has to come from the heart.
It has to come from the heart. They should have the aptitude for learning.
Yes, they should be
Then
updating themselves.
medical and whole institutes will develop. The quality of the students will be there, and students will be definitely a good outcome. A good doctor, whether it is NMC certifies that good doctor should have a leadership quality. He should have a passion for learning. He should be a continuous learner.
Yes.
And he should have respect for the seniors,
Seniors.
respect for the family. These all qualities are very essential.
It's so simple if you just follow these simple,
Yeah.
golden testaments to be
Definitely.
a wonderful doctor.
Definitely. And about AI, I think AI is going to come in a big way. India is the leading country for AI. And you know that in our own field,
Yes.
for selecting the sperm, how AI is going to help.
AI has come in.
Yeah, AI
In
is coming
imaging,
in.
AI has come into imaging.
Yeah, it is going to be in the every teaching and learning, the AI will be there. So use AI and be well versed with AI. And computers have made a lot of difference. When we were students, we did not have computers.
Yes,
Today,
you have to write
it's very
everything
easy.
down.
I tell you my own experience when I wanted to become a speaker and a topic to be prepared is I was struggling. First, you go to library, search the material.
Write down.
Find out where the books are.
Yes.
Then make a typing matter. And on the typing matter, take a photography.
Yeah.
Then you take that photography negative.
OHP sheets.
You put the color red,
We
yellow,
had the
green.
color, yes.
Then you paste it. Then put it on that the projector.
Projector
And that projector, when you press the button, it used to go into the hall. See today how it is easy
Very
that
true.
you just press a button in the computer, it will give whole thing what you want.
Yes.
And nice, beautiful slides, beautiful figures.
Charts, algorithms,
It is
everything you
very
can
easy to
present.
become a speaker now. There is nothing hard to become a teacher and speaker also. That is the reason nowadays you see in conference, there is a big queue for getting the speaker slot.
Yeah. So as you said, sir, coming to the conferences, I think in the field of medical education, instead of having conferences with huge number of delegates, I think we should move towards focused, small group of delegates with a focused conferences will go better in sharing knowledge.
Yeah, definitely. See, nowadays workshops are becoming very popular.
Yes, workshops.
Where in workshop you are going to learn a lot. Practical demonstration is there. Small CMEs with 40 to 50 people, definitely you learn.
And with
See,
a lot
now
of
when you go to
interactions.
the national conference,
Yeah.
you have about 20,000 people. So that is not going to help you
I
much.
think the trend has to change.
Yeah, you need, these conferences. That is some other reasons also.
To meet friends,
Yeah,
and to
friends,
de-stress.
enjoy, see the places by going to different place. There are other objectives.
Yes.
But learning objective is a small
Is
group.
limited. Learning is little limited.
Good discussion. And another thing what I would like to tell is that in any conference, whenever there is a topic, please keep a space for discussion.
Yes,
Now,
interaction
what
has
is
to be
happening
there.
is, as soon as their talk is over, he is already overshooted. Then the moderators will tell, you ask
No
in the
time.
lunch hour. And you go to the lunch, there is no place for you to hold the plate and eat. Where do you remember the question what you wanted and ask him?
Yeah, very true. Yeah, I
that
think
should be
those
avoided.
things
That's
need to
why
change.
I was telling yesterday in the meeting of our Kasoga Yuva, I told, if you are fixing a 1 hour slot, 3 speakers, 15 minute, 15 minute, 15 minute. Another 15 minutes
Is
is
for
keep
discussion. True.
Definitely the matter will be much discussed better.
Yes.
And all queries which are there, they will be clear.
They will be clear and they go back with a message.
I told them in Monday, you please see that every topic has got a 15 minutes discussion for a 1 hour session.
Yes, I think that has
That
to
is
be
the best way to learn. And that change has to be brought in every CME, every workshop, and interaction with the audience. Give the audience a chance.
To speak.
Many people in the audience who are better than me as a speaker.
Very true. Their experiences should be shared.
Better experience than me.
Yes.
Have an exchange with them, give an opportunity.
Yeah.
Then definitely it will be very, very successful. And having conducted so many conferences in the last 40 years, I know what are plus points, what are
Plus
minus
points,
points.
and yeah, I
And
think
we can
we have to
definitely
move
bring it.
towards that. As we said,
Yeah.
as you said, interactive sessions and
Yes.
roundtable meetings. That roundtable
Yes.
meetings
Yeah.
of small groups where discussions and
Small group
each one
discussion.
shares their experiences. I think
Yeah,
that
yeah.
also helps a lot.
And
And similar roundtable meets for the postgraduates with
yes.
their mentor and with their professor, where fearlessly they can ask.
And more so regarding online, you see, COVID has taught many lessons.
Yes.
One of the lessons the COVID, what it has done is today's our talk.
Yes, very good.
Sunita, myself, you, which was not there before COVID.
Yes.
And we can learn sitting in our place, in our bedroom, because the gadgets have brought so much change that you need not go and sit in a lecture hall and listen.
Exactly.
I think this has made a tremendous change.
And you're more focused here because you're not worried about your travel, about your
Yeah,
stay.
nothing.
You're in a
You doing
comfortable
your.
setting and your mind is open to all knowledge now.
See, other day, Professor Arul Kumar,
Yes, CTG.
London, he spoke to our Kasoga.
Exactly.
How it is so
And
easy
it was such a
without,
privilege and honor for all of us to sit in our
without,
own homes
without
and listen to
spending one pie. You have got a speaker who is at your house.
on in our house.
So that
Yes,
should
it is,
be
I think
understood that they should attend more and
we
more
have to
online
utilize
programs.
this.
That
But
will
utilize this
become.
system of teaching.
Yeah, definitely.
And I think this mentorship is what our students will definitely,
Yeah. Mentorship, good
that is what I
mentorship
think in the
makes
medical
many
colleges
things.
has to come
Yes.
in, so that fear of talking to your professor or fear of
Yeah.
talking to your assistant professor should not be there. And
Yeah.
similarly, we have to look down at our students, I think, as our interns and mentor them rather than finding fault with them or trying to pass derogatory remarks against them. And
Greatest satisfaction for a teacher is when you go to any place, you have got your students.
yes.
You go anywhere, you get 10 to 15.
Yes, definitely. You're
That is
blessed.
and
You're blessed.
look at them. They have achieved many more than us.
Yeah,
One of my student is a cardiovascular surgeon in AIMS,
very good.
which I never thought. So that will give us very much satisfaction.
Yes, gives you a lot of satisfaction. I think that is something that cannot be explained. It has to be experienced.
So that should be looked into.
Yeah, sir. So I think sir, wonderfully you have put across what is needed in medical education, like competency-based examinations, simulation-driven classes for them,
Skill labs.
case-linked performances, and the SOPs oriented, and the multidisciplinary knowledge sharing and knowledge learning gaining should be there. And of course, this continuous, once you are a medical graduate, I think that is not just that you finished your degree, you've got your degree, you've got your practice. I think this continuous learning program has to be there. And I think that has to be also stressed on all our graduates as well as our practitioners.
Lastly, exams. Now, exams must be such that the universities should conduct an exam in such a way that it is impartial, and every exam should give a good result. There should be some lot of the renovation should occur in exam system. Definitely NMC is insisting on having the type of exam what you used to have is 10 questions, solve any 6. Now it is not like that.
Okay.
All the 40 questions one has to attend.
Okay.
Line one has to read.
Okay.
You can't pass. And exam pattern is also changed. There is a pattern 25 marks, multiple choice. Unless you have read
you cannot answer them.
You can't answer it.
True.
There is another one with 5 marks. There is another one is 10 marks. There is another is 20 marks. Both essay type, the MCQ type, short answers and MCQ definitely is a good system of following. And that will definitely make, you can note down who has learned or who has not learned.
Yeah.
I think a lot of innovation have taken place in the exam. Now our students are not writing exam on the paper. We have left the paper 3 years back. They are all writing on the pad.
Okay, that
and once they finish that 3 hours, the paper will disappear from the pad.
Okay, I didn't know
the
this.
examiner goes and sits in the examination hall, he will open the paper and he will look at the paper, give the marks. Then
so
again,
it's a digital paper.
Yeah.
It's a digital paper.
Oh, the examination is digital. First university to do the digital examination was Manipal.
Okay.
After that, we have done.
So this
KV
goes on to
going
the system.
digital.
This goes on to the
Yes.
system, whatever they write.
Yes.
Okay.
Lot of changes have taken place in medical
That's
education
very
as
interesting.
far
It
as
is
the
not
webinars
only
are also concerned.
it is user friendly. It is also environment friendly.
Yes, and you know, in that the pad, it is so beautiful to draw a figure.
Okay.
Single pad will give you multiple colors,
Very beautiful.
and you can put the colors also.
So is this like the iPad or is it separate? It's made
iPad only,
specifically for
iPad. But we
examinations?
provide them.
Yeah,
We
it is
provide
made
them.
specifically for examination. It
Specifically
is
made for
coded.
examination.
It has got its own security system
Yes,
and coding and
everything.
all
It
that.
is fully secured. There is no any leakage at all.
Okay,
And
okay.
question paper will appear in front of them in their pad. There is no printed question paper.
Oh, I think we should come and take a mock exam with you in your college next time.
Yes. Leakage of the paper never occurs in that.
This was very new to me. I never knew about
This has
this.
made a tremendous change in the digital.
Okay. Well, sir, I think the discussion has gone on very well. We are reaching the end of the program. Your experience, you have already expressed repeatedly that it is a passion and you've been very happy. But over the ages, how you transformed and what is any specific anecdote or something you would like to conclude the session with telling us on this podcast?
No, definitely, one wants to become a teacher. Dedication, I tell you, sincerity should be there, because it is not that you are doing alone. There are so many people who are observing you in a medical college. I think when you want to become a teacher, definitely you should follow all the guidelines. And if you follow the guidelines, it is very easy to impart the knowledge. And you should have that aptitude to teach others. And if you have got that, definitely it is very enjoyable. Even at the age of 70, I am so happy that I am enjoying it.
Yes.
And what is more important is that when you remain with youngsters, you feel youngster, you feel young.
Exactly.
Otherwise, I have to go into the retired people club.
No. Dr. Sunita was telling that she was talking about her Alive Regenerative program. So I said, Dr. MG Hiremat doesn't need that. He has got it in his college only.
Yeah.
The regenerative program.
You imagine that when you are into the younger generation, you also feel that you are young and your working energy increases.
Yes.
You enjoy it. I think everybody should become a teacher.
Yes.
Even in their nursing home also, they should create an atmosphere. Teach your juniors, teach the nurses, teach
True.
the ayas, and every teaching and your own students also.
Yes.
So teaching is a continuous process. There is no end.
Yeah, like Gyan Pravah is this podcast which says there has to be a
Very
flow of
good.
knowledge
I
always.
congratulate Sunita for taking up this project. Sorry, I came too late, but definitely I think wonderful program, and you are part of it, Bharti.
Yes.
Congratulate you also.
Thank you. Thank you, Dr. MG Hiremat, for being with us and sharing your knowledge as a great teacher. You've been a trainer of trainers and teacher of teachers and done a commendable job in the field of medical education and OBGYN. I thank you for sharing this podcast and being my guest today. I thank Dr. Sunita Madam for giving me this opportunity to be on this Gyan Pravah, and I thank the entire support team from Evangel for conducting this program and giving us this opportunity. Wish you all very happy new year in 2026, because with the pandemic we will not be meeting you before that, and a good night to all my listeners. Thank you very much.
Thank you,
Namaste.
Bharti. Thank you, Dr. Sunita, President, and thank you, Evangel, that you have given this platform for almost an year every day. Great work. And that
shows been very seamless, sir. Very seamless without any disturbance.
Medical education. Otherwise, nowadays there is no commitment. I think such a very good commitment from Evangel also. I thank the Evangel for giving this platform. Thank you.
Yeah. Thank you, sir.
Namaste. ಅಂತ ಕುಂತ ಕೇಳಿದ್ರಲ್ಲ ನಿಮಗೂ ಪೇಷನ್ಸ್.